Warm welcome to today's talk, Tuesday the 3rd of January. Now, officially, China opened up on the 7th of December. It reversed its zero COVID policy. It's not quite the way it happened, and you won't hear this in the mainstream media. While the protests did have some effect on the government, the main thing that happened was that people were being tested on in China, mass testing. And of course, if people tested positive, they'd have to isolate for a period of time. If they tested negative, they could carry on with their daily lives. So people were actually paying bribes at the testing station to get a negative result. This means people who were positive, who had a negative certificate but were actually positive, were actually going out into the community and spreading the infection abroad in China. And this resulted in basically probably several million people developing obvious symptomatic COVID. So the infection was out and about as a result of forging certificates, and there was nothing anyone could do about it. And all the government was left to do was to acknowledge what had already happened. That was the main thing that happened in China. So abrupt U-turn on the 7th of December, yeah. Now, China's claiming that they've got 5,000 cases. Now, to an extent, this is true because they're basically not recording it anymore. But in December, there's been 248 million infections, 18% of the 1.4 billion people in China already infected. So do the maths. We're talking about, 10 million infections a day. Deaths, they're claiming, are very low, laughably low. Well, not laughably because it's deaths, but it's ridiculously low number. The WHO are claiming about 3 times as many deaths in China, and that's the WHO. So the official figure of 5,253 deaths is patently absurd. But what they're doing in China, according to this website here, which I've looked at, albeit with the help of Google Translate, what they're doing is they're only defining a COVID death if it's a death where the alveoli fill up with fluid, like a COVID pneumonia. And we are seeing very few of those now. Now, I've just been talking to colleagues on intensive care recently, and they haven't seen a case of acute respiratory distress syndrome, where the alveoli fill up with fluids as a result of COVID for getting on for 2 years now. So the presentation has changed. So in a sense, you could argue that they're right in China, that the deaths are very low because not many people are dying of COVID pneumonia. But of course, people are dying of a variety of other things. So this is the official release on that. Only fatalities caused by pneumonia and respiratory failure are being counted, but of course, deaths due to many other causes. But what I do agree with Professor Wang on here is that the main cause of death from infection in the Omicron is primarily underlying diseases. This does seem to be the picture that we are seeing. That it's not so much the Omicron that's causing death, it's the Omicron plus the comorbidities plus the old age that seems to be the main factor. Now, the UK Department of Health has strode in on this. COVID pre-departures, so if you're coming from China to the UK, you have to have a negative test within 48 hours of flying, joining quite a few other countries now, to be fair. And we're also going to start testing from the 8th of January arrivals from China. So if you're coming from China on the 8th of January and you are tested and you test positive, then they'll say, well, you're positive, we'll take a bit of a sample, we'll look at the antigen on that and we'll send it for some sequencing, but off you go, there's no quarantine. So it is an academic exercise, well, an important academic exercise, to monitor for new variants from China. Now, in actual fact, the risk of new variants from China is probably less than new variants arising in the UK or other places, because in the UK we have a lot of vaccine immunity and we have even more natural immunity. And of course, the virus has to mutate to avoid those forms of immunity, whereas in China, because there's very little immunity, there's not really these roadblocks that are going to stimulate the evolutionary process. So in China, yes, there will be new variants, and we know there's probably at least a couple hundred variants in China already, sub-variants of Omicron BA5, we believe, exclusively. So there will be a lot, because a lot of people have got the virus all at the same time, but they're probably not going to be dramatic mutations. that are caused by pre-existing immunity and pre-existing vaccination. So my anxiety levels for new variants coming out of China that are particularly dangerous is low. I have low levels of anxiety about that. I agree with my government completely. We should be monitoring it, of course, but I'm not particularly worried about it. And we can't stop it anyway because everything's got through. The Alpha variant got through, the Delta variant got through, everything gets through. We can't really stop it. All we could hope to do is slow it down. So even Professor Andrew Pollard from the Joint Committee on Vaccination and Immunisation basically we're unlikely to stop variants reaching the UK. And of course, Professor Pollard is completely correct. Needless to say, the politicians weighed in. Steve Barclay, Secretary of State for Health, to gain rapid insight into potential new variants circulating in China. I agree with him completely. That's a really good idea. And he then goes on to say the best defence against the virus, however, remains vaccination. When, oh when, are we going to hear politicians talking about the importance of natural immunity? Really? When are we going to start hearing this? This is just, natural immunity is a form of immunity. Let's at least admit that, politicians. Some are, of course, but not many. Anyway, that's what he's saying. I merely report that to you as what Mr. Barclay has said. Direct from China. This is one of my sources in China. Now, these sources I'm quoting from China, I know who they are. And they are genuinely people living in China. But of course, for obvious reasons, I can't disclose who they are. So I can confirm a lot of what you said in your previous broadcast was correct. Thank you for that. That was from a different source in China. Many being treated at home due to very busy hospitals. There is a major hospital crisis going on in China. But there again, there is in the UK as well and a lot of other parts of the world. Things aren't good in healthcare in the UK at the moment. Crematorium are backed up by 2 weeks in many cities, but there's reserve capacity. So yes, people are dying. And there's more people dying. How many? Well, we looked at an estimate which was about 3.5 thousand a few days ago. Other sources say up to about 9,000 a day are currently dying from COVID in China. But do bear in mind, this is a population of 1.4 billion. And the predictions that we've looked at are around about 250,000 deaths up to April. So when you think about it in terms of the overall population, the infection fatality rate, I'm hopeful, is going to remain pretty low. Just think of the disaster that it would have been if this was the Delta variant. If we didn't have Omicron, how much worse things would be if it was still Delta. It doesn't bear thinking about. There would be tens of millions of deaths, presumably, from that. More than 60% of my work colleagues, old and young, have had COVID in the last 3 weeks. So there you go. It's going through very quickly. Symptoms lasted 7 to 10 days. Bear in mind the last round of vaccination was 6 to 12 months ago in China. So not a lot of vaccine immunity left because we know that vaccine immunity wanes. But we do expect these vaccines to still be giving protection against severe disease and death and hospitalizations in China. And remember, the vaccine in China is not an mRNA vaccine. It's an attenuated, actually a dead virus that they're giving. It is a completely different type of virus. They're actually giving the dead antigen. The old-fashioned traditional approach to viruses is not an mRNA vaccine. So we would expect a different safety and immunity profile. Body aches, headaches, usually the first symptoms. Fever seems to come and go, lasting 2 to 5 days in China. Cough, dry with no phlegm. Runny nose, congestion, 5 to 7 days. Sore throat, 5 to 7 days. These are based on my contacts, 100 or so contacts. There's no indication that this is a scientific survey. We're not pretending that. Some people suffering from diarrhoea, but there again, they're taking some weird and wonderful Chinese home remedies. At the moment in the UK, we are not seeing diarrhoea from the Zoe COVID symptom study in the top 20. So diarrhoea is probably more a side effect of the medications that are being taken in China. Although some could be due to the COVID, it's quite feasible, as it can affect the gastrointestinal tract, of course. Most symptoms are gone for 5 to 7 days for most people. Now, this is the this source here is pretty official. Global Times in China. So we'll bear in mind it is an official source. But they're saying that very few infections are asymptomatic. So they've done a survey of 16,000 people. and they found that there's very few asymptomatic infections. So most infections seem to be symptomatic. Way fewer asymptomatic infections than we have ever seen in any of the waves, if this data is correct. Most people getting some symptoms. Attack rate, the number of people that had the infection, 25 million people in Shanghai. Official sources are saying 70% of them have had the infection already. We're dealing with just tens and hundreds of millions of people getting infected pretty well all at the same time. Within a 6-week period, the majority of the population in China is going to be infected. And as we've seen, a lot have been infected already. This is just spreading massively fast. Southwest China, it's more than 60%. Hunan, 50%. Inner Mongolia, 60% have had the infection already. So we see that this is particularly in the cities, not so much in the country areas. It's the cities that are getting infected first. It'll be the country areas next as the infection percolates out from the population centres. This study here of 16,000 people, as we said, 79% got fever. Now that is much, much higher than the Omicron we're seeing in the UK and reflects the lower levels of existing natural and vaccine immunity in China. So a lot more people are getting fever. What we're really seeing, in a sense, is Omicron in the raw, not Omicron on top of a lot of immunity like we've seen in the UK. So people are getting sick, and 79% with fever. Headaches, cough, muscle aches, all in the 60s. Asymptomatic numbers very, very low. Now, this same survey here, this Global Times survey from China, it's actually saying the numbers seen in hospital in this area are actually pretty low, 0.19%. That could be about right, actually. Online consultations, 0.78%, 85% taking their own meds, 85% didn't see a doctor. So, and this is completely consistent with the reports I'm getting. Most people are getting ill for about a week and then getting better. They are getting ill, but they're not needing any sophisticated medical treatment for most of the time, although the hospitals are crowded because there's so many people infected all at once. Even the small percentages getting sick are huge numbers, of course, as I will say a bit more in a minute. This is the People's Daily, an official Chinese Communist Party publication. Dr. Tong is telling us illness caused by the virus, relatively mild for most people, completely consistent with what I'm hearing. Severe and critical cases account for 3 to 4% of patients. These are patients being admitted, so even the majority of people being admitted aren't that ill, but a lot of people are being hospitalised. This is the hospital in Sichuan area. In the past 3 weeks, a total of 46 patients have been admitted to intensive care units, about 1% of symptomatic infections. So 1% of symptomatic infections, probably about what we would expect. I mean, when we think about it, with the earlier waves, we were seeing about 5% admitted in the UK, weren't we, with the alpha wave in the pre-vaccine when not many people had natural immunity either. So 1% for Omicron is probably about right. And the differences in these statistics probably aren't that significant. Depends whether you're looking at a community population or the population that are being admitted to hospital. So not minimising it in China at all, tens of millions getting infected, and several hundred thousand will die. But in the context of the whole population, the severe infection rate is relatively low. Another emergencies area, hospitals, and this is generally representative of China. This is from the China People's Daily. It's packed. Hospitals are packed. Beds in corridors. This is happening. WHO is asking for information on hospitals, deaths, vaccination, and variants. This guy here, Li Qian, Singapore. But the problem in China's China's transparency issue is always there. So no one thinks that China is being transparent. It really is, in a strange way, quite fascinating that 1.4 billion people, and probably about 1 billion of those, are going to get COVID within a six week 2-month period. It really is happening really quickly. Massive R values, 18, 19, 20 R values. It's just spreading at a massive rate. And as we've seen, places like Shanghai, at least 70% of the population infected already. Really quite incredible. Lunar New Year's coming up. It starts on the 22nd of January, where everyone moves around the place. But it's probably going to have already peaked by then. So we're probably looking at peak infections in the next week, 2 weeks, hundreds of millions of people being infected. But bear in mind, we are seeing, and this was actually from a TV report, we are seeing critical cases and fatalities in China due to the huge numbers of people being infected. But I can tell you now, in the UK, we're not seeing the lower respiratory tract pneumonias that we saw early in the pandemic. And it may well be in China they're not seeing this either, meaning that the Omicron in China, as in the UK, is primarily an upper respiratory tract infection, but still making a minority of people ill. But of course, as the people get infected, they will develop mucosal compartment immunity and systemic immunity, and natural immunity is spreading throughout China now just as quickly as the virus is. So we'll keep an eye on that. It is difficult time for many people in China. I'm not minimising it at all, but they're sort of doing it all of a sudden. Not the ideal approach, but that's what's happening. So we'll carry on watching it with interest. Also, lots of other things coming up pretty shortly. Flu is a big problem in the UK at the moment, so I want to talk about that. There's new variants coming up, and I've also got some interesting Freedom of Information request data to share with you shortly. But that's enough for now. Thank you for watching.